Empyema thoracis. Empyema is nothing but pus. Thoracis is like the pleural cavity. So empyema thoracis is defined as collection of pus in the pleural cavity. So we'll see the why this happens and what is it due to, and clinical features and how we're supposed to treat. What are the signs seen? Okay, let's get started. Empyema thoracis is defined as a collection of pus in the pleural cavity. It's commonly because of a complication of a pneumonia, or it can be a rupture of a abscess, which is either in the liver or in the subdiaphragmatic area. Okay. So from there it's going to rupture into the pleura, because like diaphragm and liver are very close to the lung, right? So basically the lung is sitting on top of the diaphragm. So if there is any problem underneath the diaphragm, like an abscess, it's going to rupture beyond the diaphragm and it's going to reach the pleura. Okay, so like it's going to rupture within the pleural cavity, technically. And then usually we can think about empyema thoracis more commonly associated with a best friend called staphylococcal pneumonia, because staphylococcal pneumonia is very notorious to cause some cystic spaces and all. So it's going to rupture and cause empyema thoracis. Other causes include, like other bacteria, include pneumonia secondary to pneumococci, which is like the pneumococci, gram-negative bacilli, or it can be due to mycoplasma as well. Remember, mycoplasma is also going to cause bronchiolitis, but again, in bronchiolitis, it comes under the list of causative organisms after all those viruses like respiratory syncytial virus, influenza, parainfluenza. Let's not talk about it now. We'll talk about bronchiolitis in a separate video. Okay, so we'll see the clinical features. Clinical features, because there is empyema thoracis, so like pus in the pleura, right? So pleura is going to be very a space which is pretty thin, so it's going to accommodate the lungs. So instead what happens is the entire thoracic cavity is a limited space. So if the pus is going to accumulate in the pleura, that is, yeah, if it's going to accumulate in the pleura, then there won't be any space for the lung inside the chest, right? So what happens is there will be breathing difficulty. The lung is not able to do its job. So there's breathing difficulty. Along with that, because there is a empyema, which is like pus, which is kind of like inflammation, so there will be fever along with systemic toxicity. So three clinical features: fever, systemic toxicity, and difficulty breathing will be present. Examination shows reduced chest movement with respiration, and the percussion note is dull, decreased air entry, and reduced vocal resonance. Occasionally, what happens is a new terminology called empyema necessitans, which is an unnecessary problem which happens because of empyema thoracis. What happens is that the pleural cavity, the pleural ca- the pus cavity is going to rupture, so the empyema is going to extend outside the pleural cavity into the soft tissue and chest wall. It's going to expand into the soft tissue and chest wall. It manifests as a pulsatile swelling and it's called empyema necessitans. So basically, outside the pleural cavity, if the empyema is going to extend, outside the pleural cavity is only the chest wall and what else, and the soft tissue, right? So if the pus is going to go there, it's going to be presenting like a pulsatile swelling in the chest. It's called empyema necessitans, which is unnecessary. Okay, X-ray film of the chest, it shows shift in the mediastinum with obliteration of the costophrenic angle and varying degree of opacification. Let's review this one by one. There is shift in the mediastinum because one side of the lung alone is okay. Worst case scenario, both side, but most of the time only one lung is going to get empyema thoracis. So it's going to become big, and shift in the mediastinum is going to occur. Second, costophrenic angle is usually sharp, but now because it's a fluid which is occupying it, there's obliteration of the CP angle. Third is there is varying degree of opacification because usually air is present, and now not even water. Now a pus is present, which is why there is opacification. Pleural tap is going to show a diagnostic pleural tap shows purulent material, which is pus, which is nothing but WBCs, along with high protein and low sugar. And the gram stain culture will reveal the causative agent. Empyema, the differential diagnosis could be pleural effusion, which could be due to TB, or it can be also due to cancer. Treatment is by appropriate antibiotics. Specifically for staphylococcus, we use cloxacillin, vancomycin, teicoplanin, and linezolid. Intercostal drainage, which is continuous through an underwater seal, is very helpful. CT is very helpful to find out whether there is